Have you ever left your doctor feeling like you weren't heard? Maybe you didn't understand the plan? In this video, I'm going to walk you through how to make the most of your time with your doctor. I'm Dr. Matthew Gloudeman. I've been a doctor for nearly a decade, worked in pediatrics to palliative care, urgent care, general practice, hospitals, community settings. I know how important communication is for good outcomes, and I also know that poor communication can lead to bad ones. So I'm going to give you 5 tips that you can use every time you talk to your doctor. First one, be specific. What does that mean? Try to avoid vague terms. Sometimes patients will say to me, "Oh, it's been going on for a while, doctor." My standard question to that is, what does a while mean to you? A day, a month, a week, 10 years? Because some patients will say 2 days, some will say 2 decades. So it's important to know specificity. If I'm, for instance, examining someone with a cough and they say they've had a cough for 2 days versus 2 weeks versus 2 months versus 2 years, that can change completely how I'm going to investigate, treat, and manage that problem for that patient. So it doesn't have to be exact all the time, but trying to be as specific as possible is really helpful. Second thing, most doctors, myself included, will open with an open-ended question. So we start by saying, and my standard question is twofold. I say, what's happening? What can I do for you today? Because I want my patients to know 2 things. 1, I'm interested in what's going on. 2, I'm there to help them. So if you're not sure how to answer that question, start with what the problem or the symptoms you're experiencing are. Second part is how long they've been going on for. Third is there anything you're concerned about or worried about? Fourth, is there anything you were expecting from today's review? And I'll break those down individually. So problems or symptoms. You may not know if they're all related or not. Maybe you have multiple problems that have built up since you booked your appointment. Mention all of them. Why? The 5th problem for you might be the one that I need to deal with today as a doctor. So maybe you come in and your main worry is you got some knee pain that's been going on for 2 years. But you also lost weight, like 5% of your body weight that you can't explain, which you think is a little bit nice, but you're a little bit worried about it. That to me would be way more worrying than some gradual onset of knee pain, most likely. So mention all the problems. Some doctors will kind of try and manage all of them at once. Some might ask you to book in for multiple appointments, but it's good to know all the problems so that we know what to look out for and what to address straight away. Second thing is the duration. So it's useful for us to know, 1, specifically how long, but also what's the pattern? Is it every day and now it's every hour, or is it all the time? Are the symptoms coming and going with different durations of severity? So all that's useful information. Next thing, your concerns. So what do I mean by that? Maybe you heard something on the news that made you worry. Maybe a family member or a friend made you worry about some specific condition. Maybe you read something that you're worried about, or perhaps a family member has asked you to come in because you've been dealing with a problem for a long time. All that is useful information for me as a doctor to know and address during the time that we're talking to each other, because I will specifically tell you, oh, this sounds like we should worry, or actually you're not having any of those symptoms. I don't think we should be so concerned about that. So giving them a bit of reassurance. The last bit is what you're expecting. Now, it wouldn't be me doing my job if every patient that came in, I just did what they asked of me. It's not like ordering off a menu at a restaurant. I need to figure out what makes sense medically to help you the best way that I can. So maybe you're coming in and you're thinking you need a scan, but actually that wouldn't necessarily be the right thing for you. So it is my job to either say, yeah, actually what you're expecting is what we should do, or no, and explain to you the reasons why so that you're comfortable with it. Or perhaps you bring in something that's a rare condition, a new research paper, and I've not heard of it before. It is my job to be transparent and honest, tell you, look, I've never heard of this before. You're going to be my lunchtime reading, which is often what I'll say to my patients if they're coming in with strange symptoms that don't fit into a clean box, or they're presenting something that I've just not read or heard about. So the next thing is, it is a collaborative process. So what do I mean by that? You are genetically unique. The environmental and social factors are unique to just you, and you are an expert on you and what's been going on. My job is to try and work with you to figure out how to get the best health outcomes for you for your unique situation. That means coming up with a plan that we tailor and agree upon. That means feeling like you've been heard, listened to, and making sure that what we're doing in our consultation makes sense to you. The fourth important bit, try to avoid unnecessary details. Now this can be tricky. Honestly, I know. You're not going to know what is and isn't an important detail for me as a doctor, but there are some things that are quite clear and obvious. Let's say you got into a road traffic accident and you hurt your leg. I don't really need to know the color of the car you were in, the song that was playing on the radio, or the make and model of the car, or how long it took you to get to the hospital necessarily. What I do need to know is when that happened and the details of what's happened after that. So if a patient goes off on a lot of tangents, or they struggle to organize things, or they give a lot of details that aren't medically relevant, the thing that I do is say, look, I know you have the history clear in your mind, but I've got to organize it in mine. So I'm going to ask you specific targeted questions to get specific answers. And if they start to veer or give me a lot of details, I'll say, no, I just need to know this one thing, and move on so that I can make an efficient consultation. Because what patients don't often know is I probably have 10 to 12 minutes as a GP to see you, examine you, talk to you, come up with a tailored plan specifically for you. That's how much time we've got. So time is critical, and if we're going into a lot of details, that sometimes can be difficult to get all of that in a short period of time. The last thing, ask questions. What I do at the end of most consultations I have is ask the question, is there anything else you wanted to ask? Why? Because I know that that is an opportunity for my patients to ask me anything they need to know, what they're unsure of about the plan, because my job is to be transparent. If I'm organizing a scan, I'm telling them why I'm organizing a scan. I'm not saying something vague like, oh, we're just looking for a few things. I'm saying, look, some of the symptoms sound like it might be cancer, or some of the symptoms sound like it might be problems with kidney stones. So I'm going to organize this investigation to see what's going on. It is important for you to ask questions if you're not sure about the plan, if you're not sure or comfortable with what's going on. If you're still worried about something, ask as many questions as you think you need to, so that you can leave that consultation better than when you went into it. Hope this video helps you. It's a quick video. There's many more on my channel, but if it does, please share it with someone else so they have better outcomes too.